Hello, my name is Rudlyn Petit-Homme, and this is a head-to-toe assessment for St. Thomas University for Advanced Assessment class. Now, we're going to start. This is going to be my model, and then we're going to do a complete head-to-toe assessment with history, and then I will be asking her questions, and I will also do a hands-on assessment. So basically, I'm going to be collecting objective and subjective data. So, with that being said, we are going to start, and I'm going to allow my model to introduce herself. Her name is
Janet Smith.
Her name is Janet Smith. All right. I'm going to pretend that I was out of the room, come back, we knocked, for provide privacy for the patient, and then when I do the history part of the assessment, I'll be sitting down just so I can be eye level with the patient, because standing up will sometimes make a patient feel intimidated or a little bit shy or reserved. But if I do sit next to them and talk eye level, they tend to be a little bit more relaxed and then friendlier and provide me with the information. So with that being said, we are starting. So may I come in? Thank you. Good morning, Miss
Good morning.
Jeanette. How are you?
Good. How are you?
Good, good. My name is Rudlyn Petit-Homme, and I am a future nurse practitioner. So basically, I'm a student, and then I'm going to be doing your assessment, your history, and everything. Can you tell me your full name and date of birth, please?
It's Janet Smith. April 28th, 1980.
All right.
Okay.
Okay, very good. And then, are you having any discomfort or any pain? Is that what brought you to the hospital today?
Just a little soreness in my neck.
Okay, no
Just
problem.
kidding. No.
Okay. So another thing I'm gonna ask you, can you tell me a little bit of your history, medical history? I mean.
Well, I gave birth, just a vaginal birth,
Okay.
normal.
Okay. Have you ever had any issues in the past? Any surgeries in the past? Any form of chronic diseases that you are taking medication for?
No.
Nothing. Okay. All right. Very good. So at this time, I am going to ask you to stand up so I can take your weight.
Okay.
I'm going to be checking your weight, your height, and then your waist circumference, and also with these numbers, I'm going to plug them in and tell you what is your BMI. And BMI stands for body mass index. That tells you exactly if you're overweight, underweight, obese, or things like that. All right? Would you stand up for me right on the scale? Thank you. Okay. It's electronic. So, all right, thank you. Now I'm gonna need you to turn around facing me so I can measure your height. So I'm pretending there is a measurement in the back. Oh, okay, you are 5 feet and 3 inches tall. Very well. Okay, and you weigh 110 pounds. All right, you may have a sit. Thank you. Okay. At this time, I'm going to check for your waist circumference. I have a meter, just so you know. Everything is a little bit imaginary, so we're gonna have to use our imagination here, because I'm limited. Okay. Okay. All right. Thank you. All right. At this time, what we're gonna do is I'm gonna be doing what we call a head-to-toe assessment. So I'm gonna start by looking your head, your scalp, and then going down to your face, looking at your eyes, your ear. And when I'm doing that, I am checking for your eyes, for example, I'm checking for reaction to light, and making sure that your pupils are what they're supposed to be. Also look inside your ear for any ear infection or excess wax buildup, or any foreign bodies or anything that seems to be abnormal. After that, we're gonna look at your nose, your mouth. I'll ask you to open your mouth and say things like that. And with a tongue disperser, we'll look inside and making sure that you can see your tonsils, nothing is swollen, no form of abnormality. Then we'll go down to your glands and your neck, and then from that point on, we go all the way down to chest. I will be listening to your chest, meaning listen to your lungs, in front and back, for breath sounds, making sure that they are clear, or if I hear anything, I'll let you know. I'll also listen to your heart, and then check for your pulses, check your abdomen, and all of that. Okay? All right. So because I've already tell her what I'm going to do, I will not talk over the video. I will just go ahead and do them. And if something needs to be mentioned, I'll mention it as I go. But I will start from head and to toe to assess everything. Okay. So do you mind if I remove?
No, not at all.
All right. All right. Just gonna take a quick look here. And before this, of course, I wash my hand and I don't glove. They are here. You just can't see them. Okay. All right. Your scalp is a little bit dry. You know that. Okay. All right. I'm gonna be looking at your eyes. Can you open your eyes for me wide? All right. So I'm gonna be using my little flashlight to look at your eye. Okay. So I'm gonna start from outer, inner, and then I'll do this side. So I'm looking for a pupil reaction. So they're supposed to constrict when the light hits the middle, and which they did, and they are a number 2. Okay. Now I'm gonna be looking at your nose. Do you mind taking your mask off? Oh, thank you. And tilt your hair backwards. Thank you. Have you had any injuries to your nose? All right. Septum is symmetrical. Can you open your mouth for me and say ah?
Ah.
Okay. Thank you. Stick your tongue out. Move them side to side, up and down. Thank you.
Sorry.
No, it's okay. It might be a little bit silly, but it's important. Now I need you to give me a smile. So when I do this, I'm basically checking to see if both sides of your face is symmetrical. Okay? Because patients with some form of brain damage sometimes, like a stroke or anything like that, or even chronic issues like cerebral palsy or things like that, they might have a droop and the face is asymmetrical. So we have to make sure all of that is okay. Now I am going to look inside your ear. Okay. So I'm pretending that I have my instrument and I'm looking inside your ear for any form of infection, any form of abnormalities, which I see none. Okay, very well. Alright, I'm going to be checking your glands to see if they are swollen, if they're tender. Does it hurt when I press? Nothing. Alright, very good. So now I'm just going to check your chest and palpate a little bit, and you tell me if you feel any pain when I do this. Any discomfort? None. Okay. I'll also check the back. Any discomfort when I do this? Alright. At this time, I'm going to listen to your lungs. And when I listen to your lungs, I'm going to listen both sides on the upper, middle, and lower lobe, okay? And I'm going to be asking you to take a deep breath for me. Can you take a deep breath for me? Thank you. Again. Thank you. Relax. Again. Relax. Now this side. Again. Relax. Again. Alright, thank you. Okay. I'm gonna do the front now. The anterior portion. Take a deep breath for me. Thank you. Relax. Again. Relax. Very good. At this time, I'm going to listen to your heart. You don't have to take a deep breath. You just stay still for me. And I'm going to be doing it for 30 seconds. Okay, thank you. So, I'm going to be checking for pulses. You have various pulses that I need to check on. For example, your brachial pulses, your radial pulses. Yeah, I've already checked your apical pulse, which is your heart. And then I'll be checking the other pulses in your legs as well, like popliteal, posterior, and dorsal. Okay? So, alright. Let's do them together. Very well. Very You can stay in the sitting position. I'm gonna check, but you can relax your leg for
Oh,
me.
sorry.
I'm just gonna check. This is popliteal tilt. I'm checking the back of your knee, both side there, and this will call by your ankle is posterior. Okay, and I'm gonna pretend that your shoes are off, and I'm gonna check your pedal pulses, or dorsalis pedis, how is it called? Okay, pulses are equal or per out, and they are +2. All right. At this time, I'm gonna ask you to lay down for me on your back because I'm gonna be checking your abdomen. Okay, so I'm gonna be touching your abdomen all throughout. If it hurts or it's too tender, you have to let me know. Okay, I'm gonna be checking for mass or any tenderness. All right. Oh, it tickles. Does it hurt? All right, very good. Now be sure, so we're gonna be listening for vowel sounds about 4 quadrants. Okay, you have very good vowel sounds. Good. Okay, you can sit now for me. Alright, so for the purpose of this video, I would not ask my patient to remove her dress or gown or uniform or whatever she's wearing, but I'm gonna pretend that I'm checking her skin to see if there's any lesions, rashes, redness, anything that is abnormal, irritations, burns, anything. Okay, so for now I'm gonna pretend that she's completely naked and I'm able to see through her, and I do not see any form of abnormalities or irregularities in her skin. She has very good skin turgor, not dry. And then her legs, yep, not dry. And then her back, everything seems to be okay, in order. All right, now I'm gonna be going back to her neuro status and strength. I am going to ask you to, I'm gonna do what we call, grasp test. So I'm gonna ask you, I'm gonna check for your strength to see if you're equally on both sides. So I need you to squeeze my fingers as hard as you possibly can. Thank you. Very good, and let go. So now I'm gonna ask you to raise your arm up like so. I will be pulling them, and you need to resist and pull back when I do that. Okay? Go ahead. Very good. Now I'm gonna do it so like this, pushing, and then you resist me. Very good. Very good. I'm gonna do the same thing for your legs. I'm gonna be pulling them towards me and pushing, and you have to resist.